mental health tayo sa panahon ng COVID-19 crisis. Makakausap natin si Dr. Agnes Joy Casino, psychiatrist mula sa National Center for Mental Health. At pwede rin po kayong mag-post ng inyong comments o tanong sa aming Facebook Live. Magandang hapon po, Dr. Casino.
Hello, good afternoon. Good afternoon, everyone.
Ma'am, nung simula pa lang nitong COVID-19 crisis, may mga nagbabala na posibleng magkaroon din daw ng mental health crisis. So gusto lang namin malaman based on your assessment, ano po ba ang sitwasyon ngayon ng mental health ng mga Pilipino?
Yeah, hello. Actually, we don't have the exact data as to the mental status of the Filipinos right now. We are still working on that with the mental health law, but basically, kung makikita natin, everyone with this pandemic, lahat kasi tayo talagang under extreme stress. So there are actually 4 groups of people generally na kung paano din, this will define also kung paano din sila mag-respond to crisis. So the first group of people, those who are, ang dami nilang stuck na resilience. So ang galing ng coping skills and mechanisms sila from the start, and sila yung group of people that who are really fine. Pag tanungin mo sila ngayon kung kamusta kayo with the pandemic and all, and they're okay. So we believe them that they're okay. The other group of people are yung extreme naman. These are dati ng patients, dati ng mental health service users. Sila yung diagnosed na even before the pandemic. So this group of people, sila yung high risk to be hospitalized again because of the pandemic. The other two groups, sila yung medyo kailangan natin bantayan. One of which is the group na meron na silang nararamdaman before, meron na silang siguro may mga mild depressive symptoms sila before, or mild anxiety symptoms sila before, and ngayon because of the crisis, because of health and actually economic crisis, talagang mapupush sila into having psychiatric or mental illness. Then the other group of people, meron silang konting resilience na natira, meron silang coping skills na naipon. But with the current situation ngayon, medyo sila din yung nagkakaroon na nagsistart sila having depressive symptoms. And these are actually the millions of people around the world. Sila yung mas malaking bahagi. So with this people, kung titingnan mo, you give them structure and stuff, or tanggalin mo sila from the crisis, or tanggalan mo sila ng ano ang anxiety nila, or kinaka-anxious nila, or kinaka-depressed, kinakalungkot nila, then they will be better. So yun yung general picture of mental health.
So with what you mentioned, yung 4 groups, ano po ba yung, especially yung mga hindi naman, kasi nga abnormal times tayo ngayon normally kung maayos sana yung sitwasyon, okay ka lang sana, pero yun na nga, kakaiba yung sitwasyon. So ano po ba yung mga kakaiba rin na nararamdaman ng mga taong ito when it comes to mental health? Ano yung common na magmamanifest siguro?
Yeah. With the crisis kasi, lahat, di ba, is uncertain right now. So it's normal that we feel the uncertainty. We feel anxious about ano ba ang mangyayari tomorrow. Do we still have work? Do we still have... Syempre, there's also fear for our own lives. Parang ganun ang nangyayari. And we grieve, actually, for yung mga losses. Kung titingnan natin, it's loss, not just... not life na loss, but loss about job, losing your friends, losing communications or contacts with other people. Diba, human beings, we are human beings, so we are actually social talaga beings. Pero yun yung parang nawala sa atin ngayon, and losing control. So it's normal that you feel the anxiety or the uncertainty, and you feel nalulungkot because of that. But that feeling could be actually normal.
So ano po yung,
under abnormal situation.
Doktora, ano po yung manifestation? Yung laging nalulungkot, hindi makatulog? Can you tell us? Kasi baka maraming nanonood sa atin, akala nila normal lang yung ganun. Yun pala, kakaiba na yung...
Yeah.
Yes.
Yeah, okay. With the symptoms naman na nalulungkot ka, hindi ka na makakatulog, hindi ka makakain, there are several factors na titingnan natin. First is, yung hindi ka ba nakakatulog, ano ba ang ginagawa mo? Some people kasi di na makatulog because nagso-social media or because yung mga kausap nila gabi naman gising. Or some people, hindi na nagiging regular din yung sleep because hindi na nadidelineate kasi 'di ba since naka-quarantine. So hindi na delineate nila na today I should be sleeping at 10 o'clock. So hindi nila na delineate yung time nila. So minsan our biological clock affected
Mm.
siya with the change din sa behavior and actions natin. But then to the point na if all areas in your life, including the functioning, kung talagang nakatulala na siya with depression kasi it must be actually 2 weeks na makikita mo na may mga symptoms na gano'n. And you can actually feel or makikita mo sa sarili or from other people around you na nagsasabi na you are not the same way. You are not functioning the same way. So as before. So that one, maybe you need actually professional support.
Mhm.
And I'm saying it's support.
Mm-mm. Doctor, yung binanggit nyo rin kanina when you talked about the 4 different groups of people, meron kayong sinabi dun sa mga may mga pre-existing mental health conditions. So, paano naman po sa kanila? Kasi yung iba talagang naninibago eh. Pero paano naman po yung binanggit nyo nga na dati na may ganitong kondisyon?
Mhm, mhm. For those naman with pre-existing conditions na exacerbate because of the crisis right now, talagang kailangan nila ng help. Kailangan talaga nila ng professional support. So there are ano siya. So for families particularly kasi sila yung kasama ngayon ng mga tao, I mean the mga service users natin. So kailangan talaga ng support agad, ng help agad. So they can actually do consultations agad kasi to prevent na the exacerbation or further exacerbation of their symptoms, yung mga illness nila before.
Doctora, you mentioned yung kailangan nila ng professional support. Is it the same? Kasi I also have friends na parang nakaka-zoom naman nila yung kanilang mga psychiatrist. Is that the same as a face-to-face consultation? And also, paano naman if you need to give them medicine, yung mga pagreseta, ano po proseso dyan?
Yeah. Right now kasi parang the same thing with everything like ngayon the interview has to be on Zoom, the meetings on Zoom. So we are also working on consultation or the telemedicine yung ginagawa. It may not be the same as talagang face to face na consultation or in person because syempre there are other things na napapansin ng professional na psychiatrist na hindi mina-manifest or hindi sinasabi ng person but nakikita namin. So it's not really the same but it's the next best thing for now. And as to prescription, we actually ang Bureau of Food and Drugs or FDA na I think ngayon, they actually allow e-prescription.
Yes.
So yeah, so even us, the psychiatrist, we can provide a prescription and they can buy the meds prescribed
Okay.
to them in the drugstore. So
Sige po.
ino-honor naman.
Marami pa tayong pag-uusapan mamaya, Doktora. Lalo na yung mga may nakikita ako, may mga tanong na dito sa ating Facebook Live at pwede po kayong sumali sa aming talakayan. Maglagay lang ng inyong comment dito. Manatiling nakatutok sa Newsroom ngayon. Balik ang Newsroom ngayon dito sa CNN Philippines. Pinag-uusapan pa rin natin ang mental health sa panahon ng COVID-19 pandemic. Kasama si Dr. Agnes Joy Casino ng National Center for Mental Health. Dok, puntahan natin itong mga tanong sa ating Facebook Live. Sabi ni Rosie Montañez, ano ba ang dapat gawin kung stressed o yung tinatawag na insomnia? May gamot po ba doon? Parang siguro yung binanggit nyo lang kanina na medyo abnormal siguro yung sleeping hours. Ano po kayang pwedeng gawin dyan, Dok?
Aha. So, actually, kung kaya pa naman natin talaga, ngayon, ang pwede natin gawin is to actually regularize our sleep and our eating habits. So kung ano yung normal nating ginagawa, like for example, if it's at dati wala pang pandemic, it's 10 o'clock natutulog tayo. So ngayon, we try to sleep at the same time pa rin. So during the day, hindi ka matutulog. Yung katulad ng ginagawa mo dati, if you were working before and now you are working from home, gagawin mo pa rin yun, yung the usual mo, na yung 10 o'clock matutulog ka, or yung 8 o'clock ng gabi kakain ng dinner, and 10 o'clock matutulog. So the same, we will follow that same sleep na habits natin. But if talagang may problem and you cannot really sleep, and medyo iba-iba na yung inaiisip mo, you really have fear of dying, for example, na extreme na affected na rin yung mga yung other functions mo, like for example being a mother or being a sister or being a father, affected na siya, hindi napapabayaan mo na for example yung mga anak mo, and then that's the time that I think you will need support from our professionals.
Dok, kasi like ako, minsan kung regular tulog ako, for example, 11 p.m., ngayon talagang hindi na rin ako makatulog ng ganong oras, no? Parang usually 1 or 2 a.m. na, no? Pag ganun, ano bang pwedeng, syempre, yung paggamit ba ng social media or pagtingin sa cellphone ay hindi mo dapat ginagawa, o yung masyadong panonood ng TV? What else can you do para maibalik yung dati mong routine?
Yeah. Usually din kasi, the reason why hindi makatulog na agad because busy kaka social media. So you avoid also doing social media. So mag-detox ka naman ng mga 2 hours before sleeping. And then ngayon kasi naging habit na natin, no, yung most people na tinatabi yung cellphone. So as much as possible, kung hindi ka naman naka-duty on a 24 hours na kailangan may tumatawag sa'yo, may ini-expect kang ganun, or emails na tinatanggap, then you, as much as possible, you avoid having your cell phones or gadgets beside you or on the bed. Kasi syempre, meron kasi tayong tinatawag na sleep hygiene. Yung mga ginagawa natin on the bed should be sleeping lang siya talaga, purely sleeping. So our brain also will be trained na when you are on the bed, then you are ready for sleep. So ganun dapat siya. You don't bring your work on the bed.
Ito maganda yung tanong ni Rosie Montañez. Meron daw siyang caregiver daw siya sa Taiwan at tinitignan niya kasi yung pasyente, so lagi siyang gising. Pero would you advise daw na mag-sleeping tablets?
Actually, the sleeping tablets, ano kaya yung minimi niya? Kasi there are sleeping tablets naman talaga that are prescribed by doctors for people who really cannot sleep or may sleep problem. Kung if it's primary insomnia, may tinatawag kaming primary insomnia, so different yung management for that one. But sometimes it's not really an insomnia. Minsan kasi insomnia or an inability to fall asleep or to maintain sleep, merong ibang dahilan. So, kung sleeping tablet, there are sleeping tablets, especially yung dito sa atin, the benzodiazepines, nakaka-cause kasi siya ng addiction to the tablet. So, parang gano'n. So, hindi siya advisable. But there is melatonin, if you're familiar with that one. Melatonin kasi, it's actually, it can help regulate sleep. So, pwede siyang i-take.
Okay, si Marilu Carillo, ano po ba ang tawag sa hindi nagsasalita? Kasi hindi naman daw dati ganon. Siguro ano pa to, manifestation ba to of something na kung parang biglang naging tahimik ang isang tao? Ano po ba ang gamot pag ganyan po ang sakit? Tanong ni Marilu Carillo ko.
Ano kayang reason na hindi siya nagsasalita? Kasi minsan pagka may mga tao kasi na hindi nagsasalita, mayroon kaming tinatawag na selective mutism, may mga bagay-bagay na hindi na nasasabi, kaya hindi siya nakakapagsalita na. But there are also things na kung ang sinasabi niyang hindi nagsasalita ay withdrawal, like for example, dati ay nai-engage mo naman siya and ngayon ay nagwi-withdraw na siya, nagpupunta na siya sa kwarto niya, ayaw na niya makipaghalubilo, ayaw na niya magsalita, then that's something that needs further investigation and further for management.
Doctor, kasi may nabasa rin ako na for some patients, siguro ito na yung medyo, yung may previous mental health conditions, no? Parang tumataas din daw yung risk for suicide. May ganyan po ba kayo or any other explanation for that?
Yeah, ang suicide kasi talaga depende siya. So it could be suicide because of the symptoms. Because minsan kasi they hear voices telling them to do suicide or to kill themselves. Minsan because they lose hope or they are becoming helpless and they do yun suicide ang escape nila. Some people naman nagsi-suicide on impulse. Like for example, well, there are cases naman kasi talaga particularly with our OFWs, if you have heard issues about them, na some of them nagiging suicidal, and then actually we get referrals for those concerns because of yung pakiramdam mo na nakikage ka na and you cannot like do anything else. So it's for them, it's more of an escape from the reality and more of being impulsive. So yun yung nangyayari. But so far I cannot say na tumataas talaga
Risk.
ang rate of suicide.
No, but the risk, doctor. Pero,
Yeah.
okay. Doc, yung isa, so pag ganyan, yung minention nyo na mga ganyan, ano po ba yung sitwasyon na dapat, if you see yung kasama mo sa bahay or kapamilya mo na may gano'ng kalala na yung sitwasyon na dapat kailangan talaga ng professional help?
For us kasi to marami kasi din sa atin, 'di ba, yung kung mag-isa ka lang hindi mo na alam kung talaga bang you are behaving differently or something na gano'n. So siguro for us, for eto na medyo aware tayo about what's happening, it's good that we call up people, we ask them kung kamusta sila. They may not be saying something, or minsan din kasi kung talagang yung mga mentally ill na before, you get to see their post, parang may nagbabago, nagiging dark yung theme and ganon yung mga pinopost sila, then it's time that they need help or they need the support. Mas maganda na mas maaga maaagapan than too late na yung mga symptoms or nandun na siya sa end ng talagang disorder. Pagka dalawa kasi siya, the mental health concerns, ibig sabihin meron ka lang issues and na hindi na deal on your own, and the disorder talaga. So sana maagapan natin na dun pa lang sa concerns and mental health issues pa lang, dun pa lang maaagapan na natin.
Doctor, kasi yung pag-health cards, hindi covered ang psychiatric consultations. Tama po ba yon?
Yes, pag private, yes.
Pero what they can do is they can go to public institutions like sa National Mental Health. Opo.
Yeah, right now we also do not have our outpatient consultations. So right now, kasi we're still working on telemedicine, parang teleconsultations, but we cater to refill of meds. For example, if someone will need medications, so we prescribe and they can actually buy here. Or old patients namin, binibigyan namin ng prescription. And for those who are really in crisis, they can come 24/7 naman yung ER namin bukas, so they can come to the National Center for Mental Health.
Okay, we're flashing your numbers, Doktora.
Yeah. And there are also other service providers naman that they can actually check on, like the Philippine Mental Health Association, the Mind Matters. So there are other also providers.
Doktora, kasi nyo last na lang, ang bilin nyo for Filipinos to keep their mental health healthy and stable?
I think for us Filipinos, kasi 'di ba know naman tayo that we are happy people, we are resilient people. So kaya lang kasi for me, resilience kasi is not something that it's not how long you endure adversities, but it's actually how you rise up from an adversity. So ganun kasi yung resilience. So for everyone, siguro it's best that we keep ourselves updated kung ano yung mga government na mga advisories and mga ano yung mga protocol, we follow them. But if talagang nakaka-distract sa'yo and you are affected by the news, hindi maganda, you avoid those ones. And you keep your actually your regular na routine. So if it's work from home ka na ngayon, but you still have to get up at 7 o'clock or 6 o'clock, so you follow that one para yung body clock natin hindi magulo. And it says, di ba, if you have siguro nakikita naman natin na they actually change from social distancing, now it's physical distancing because we cannot avoid to have social contacts talaga because we are social beings. So
Okay.
yun yung pinaka-message.
Maraming po salamat sa inyong panahon, Dr. Agnes Joy Casino ng National Center for Mental Health. At magbabalik po ang newsroom ngayon.